Hello, I'm Dan Handelman, and I'm with Flying Focus Video Collective, and I'm also with Portland Copwatch. And tonight we're going to be talking about the Behavioral Health Unit Advisory Committee, which was created in 2013, almost 9 years before the show was produced, as part of a lawsuit that the Department of Justice from the United States imposed against the city of Portland as part of a settlement agreement in that lawsuit because the Portland police were using too much force against people, particularly people with mental health issues. The Bureau agreed to create a behavioral health unit and this advisory council or committee, which is made up of at least 15 people. That's how many people are on the roster at the time we're making the show. And then they started having meetings behind closed doors in 2013, and people in the community, including Portland Copwatch and members of the committee, were urging them to open up the meetings, and they said they didn't have to do that, and they've never had public meetings where they were talking substantive issues. This year, 2021, they started having public meetings on a quarterly basis just to engage with the community and explain who they are and hear concerns from the community. At the one that was held in October 2021, the issue came up about how the police are still using too much force, especially killing people in mental health crisis. So you're going to hear from some of the members. There are only a few of them were there this night, and one of them was Lieutenant Casey Hetman, who's the head of the Bureau's Behavioral Health Unit. And then after you hear some introductions, you're going to hear the public input part where I brought up that issue.
The mission statement of the Behavioral Health Unit Advisory Council, or BHUAC. We'll start with that. So in accordance with the proposed settlement agreement between the U.S. Department of Justice and the City of Portland, the purpose of the BHUAC is to provide guidance to the City of Portland and PPB in the development and expansion of their enhanced crisis intervention team, behavioral health response team, service coordination team, and Bureau of Emergency Communication, BOEC, crisis call triage and utilization of community-based mental health services. The BHUAC will analyze and recommend appropriate changes to policies, procedures, and training methods regarding police contact with persons who may be experiencing a mental health crisis or have perceived or real mental illness, with the goal of de-escalating the potential for violent encounters. Members of the BHUAC believe in the power of relationships and look forward to the work we will do together. And so there are some requirements for membership and who should be included. And so representation must be from PPB's Behavioral Health Unit, from Multnomah County Mental Health and Addiction Services Division, the Bureau of Emergency Communications, civilian leadership of the city government, and shall seek to include representations from persons and family members with lived experience with mental health services, the Multnomah County Sheriff's Office, Oregon Health Department, advocacy groups for consumers of mental health services, mental health service providers, coordinated care organizations, and a member of the Multnomah County Public Defender's Office. And all members shall have voting rights with the exception of sworn members of PPB. I'm Janie Gullickson, co-chair of BHUAC, but also a person with lived experience of very public mental health challenges and decades of addiction. And I'm also a person in long-term recovery from not only addiction, but what I like to say is a diagnosis of severe mental illness. I don't live under that diagnosis. It doesn't define me, but there is a piece of me. And my day job is executive director of the Mental Health and Addiction Association of Oregon, and we're a peer-run organization. And so we offer non-clinical support services, direct peer support, recovery mentor services throughout the Tri-County area, and train the workforce and so much more. And I don't want to make it about MHAAO, but I think, not only do I come, from the personal lived experience of, more than I can count interactions with law enforcement. But also in supporting people who have. And I was a peer support specialist myself after incarceration, and just got to use this lived experience to walk beside others. And part of, the peer workforce, our charge is to also share our voice, that it was a group of community leaders that really care about their charge, their mission, their the folks that they're serving. I mean, that's the whole point, right? And for, to create a department, the behavioral health unit, that does better, that it does right by the people. And I believe they've done that, and it's been great to be a part of. Policy work. Sometimes I think, that can sound so boring, but it's just been a great experience, and everyone is so respectful and also speaks truth. And we don't, always have to have the same opinion, and often we don't, but we do have respectful conversations, and that's what I've appreciated, and debate even at times.
Emily Roshan, I'm the Service Coordination Team Program Manager, which we are under the umbrella of the Behavioral Health Unit. I always say it's kind of the addiction side of the house. We are in contract with Central City Concern to provide housing and addiction and access to addiction treatment services for folks who have chronic addiction, chronic homelessness, and chronically in and out of the criminal justice system. I'm an addiction counselor by trade. And so I've been an addiction counselor for the population that we serve. Also manage the housing portion of the contract. And now with PPB, providing oversight with the contract. Even through all the different perspectives that we have on the advisory committee, we really listen to each other and respect each other. And it's almost like we all have the same goal. It's just that we have different roles and lanes and experiences. But we all embrace that, the same goal and the same mission.
My name is Beth Epps. I have several, different roles and ways I think about being on the BHUAC. My day job is with Cascadia Behavioral Health Care. I'm on the executive team there, and the behavioral health programs are my responsibility, including the crisis teams. So certainly the Project Respond is part of the behavioral health unit, or part of Project Respond is part of the behavioral health unit. And working with the staff in that and with those services is part of my job. So I bring that, and I think that was my first official representation to be on the committee. I've been on it, I believe, since 2016. For me, it helps think about the system as a whole, that it's not just the crisis services or just the police or just this. It's if the whole system doesn't work. One system can be working beautifully, but if we don't really try to understand how it all works together, we're always going to be, bumping up against something. So I love the notion that it's a group of people that come together that are thinking about not just that one piece, but how it fits in the whole.
My name is Melanie Payne. I use pronouns she, her, and hers. I work currently for the Bureau of Emergency Communications, otherwise known as 911. I'm the Training and Development Manager. My primary responsibilities are to recruit and hire new 911 dispatchers, and also oversee all of their training, their initial training and their ongoing training. If you are following the news at all, you know that I'm very busy. So that's really the hat that I wear when I sit in BHUAC. Another hat that I wear is the liaison for the Bureau for the Department of Justice agreement. There's 3 tasks that relate specifically to BHUAC. There's several other tasks that BHUAC is included in, but there are 3 specific tasks, and I am the liaison for our Bureau to ensure that those tasks are being met. I am also a family member of someone who lives with mental illness. I have several family members who experience mental illness, so it is very nice. Nice is too gentle. It is very comforting and affirming to be around folks who think about people first, and things that, illness, crisis second. I don't have a background in counseling, so I have access to amazing professionals who can help me understand good ways to communicate to other dispatchers who are lay people who don't know very much about mental health, behavioral health. So I just have such a great resource for myself in order to do my job well, which in turn benefits our community.
Melissa Eckstein. I'm the president for Unity Center for Behavioral Health, and I apologize that I'm not on video tonight. I had an appointment that I couldn't get out of, but I really wanted to be a part of our meeting tonight. A little bit about my background. I am a licensed clinical social worker, and I did clinical work for over 20 years doing crisis intervention. So actually, grassroots out in the community, helping people who were in crisis and helping them get connected to resources and hopefully avoiding, having any law enforcement interaction or needing to seek out inpatient care. What drew me to be a part of the advisory council is one, I think we have some very compassionate individuals, and I'm really happy to be a part of the group. But what really drew me was helping our community and continuing to improve and to advocate for people to have access to the care that they need in the right moment, and hoping to be a voice that helps with that.
I think I may have asked this question in a different way in an earlier meeting, but there's more of you here tonight. And I'm really glad to see that. I think that's really helpful. My question, it has a lot more urgency now than it did 6 months ago. Since the DOJ came here to try to reduce the amount of violence that the Portland police are using against people in mental health crisis, and out of the 6 people the Portland police have shot this year, 3 of them were killed, and at least 3 of the people, one of the people who didn't die, and 2 of the people who were killed were in mental health crisis. So we've been working on this for, the DOJ came in 2011, imposed a settlement agreement in 2012, formally started in 2014. But really, we've been aware of this problem for 9 years now, and we're still seeing people get shot and killed by the Portland police who are in mental health crisis. And I'd just like to hear what kinds of discussions there are about that in the committee.
Go back to the work of the BHUAC, and that is to advise on policy, and I'll find the list, but that's certainly, I believe, outside our scope. And so no, that is not something that is discussed.
I would say that yes, it's outside our scope of what we do as a committee, but we're not oblivious, and just our understanding of that's part of how we think about and what we think about when we review policy, when we make recommendations on policy, and when we think about the system as a whole and how we might be informative and thoughtful about recommendations just around the entire system.
The next person you're going to hear from is Jared Hager. He's the local attorney from the U.S. Department of Justice, and he references paragraph 95 of the agreement, which says that this committee is supposed to analyze and recommend appropriate changes to policies, procedures, and training methods regarding police contact with persons who may be mentally ill or experiencing mental health crisis, with the goal of de-escalating the potential for violent encounters. One of the responses includes discussion about the PSR, Portland Street Response, which is a non-police unit that was created in 2021 to send people out who aren't police to handle people who may have mental health issues.
I wanted to follow up on a question Dan asked earlier with regard to, tragic consequences of officer-involved shootings. And I understand, from the committee's perspective that isn't within your purview and that you're not looking at perhaps changes in policies or procedures or training methods with the goal of de-escalating the potential for that type of violent encounter when it happens. And while I might disagree, at least based on what I read in paragraph 95 of the settlement agreement, I'm wondering if you could help me understand where the committee got that advice. Why does the committee think that those cases are somehow off limits or outside of the potential for a recommendation for training or a recommendation for procedure? If you could help me understand that, that would be very helpful. Thanks.
Jared, I think that informs absolutely the recommendations that we make with regard to policies, procedures, and training methods to de-escalate and not have those situations happen. I think that is absolutely our purview. But to sit and discuss the fact that, the instances or the details of these three, and there's been no advice to say that that's something, that we shouldn't be discussing, but the specific details of those, that seems outside of scope. Those were my words, not anybody else's that said, oh, we're not going to discuss this because it's outside of scope. So hopefully that clarifies. Those were just my words. But I think it absolutely, overall, that's the reason, or one of the main reasons we exist, is to absolutely do that. What I understood Dan's question to be was, do we sit there and discuss the details of those occurrences? And that's not the case. But again, I want to say, I agree with the section 95. That's the core mission of our work, is to those instances, all of them, past and present, inform our work.
Has the BHUAC analyzed the training implications or perhaps the policy or procedure implications from a particular violent encounter in the attempt to improve how those encounters might go in the future?
No, that has not happened since I've been on the committee.
I know from my perspective, from working at 911, I don't know that we have enough information. We certainly don't at 911 have enough information to make an informed discussion about this. So I would be hesitant, and until we have information that we can advise on, we don't know any more than what's shared in the public.
I think, well, Melanie and Janie kind of alluded to this a little bit too. I think OIS, or officer involved shootings, excuse the acronym, officer involved shooting or in custody deaths are obviously very complex situations that both have concurrent criminal and administrative investigations that happen. And then also we have a number of other internal things that take place. There's training reviews, internal affair reviews, and all those other things that do take quite an amount of time. And so there is a huge training component that is undertaken with these investigations that fall into the training division. So those are taking place. It maybe isn't taking place under the umbrella specifically of the BHUAC. However, when speaking of paragraph 95, I think the BHUAC does do good work in that arena. And I think that they do take their collective knowledge and bring valuable perspective from the social services, the communities that they represent, and bring that to the table, being informed with the knowledge of these events that do take place in the community that are widely known. We had a meeting today. It was very well attended. We had quorum, and I think nearly every member was there. And we talked at length about an upcoming enhanced CIT officer certification course that's happening in November. And so I do take a little exception that we aren't the whole idea is looking at de-escalation, and as a learning organization, we're looking to find new tactics to avoid tragic outcomes, obviously, and they come in any number of forms, but we are constantly looking at ways in coordination with the training division to de-escalate things and find other alternatives to obviously those horrific and terrible results.
I think I'm going to start a little bit by talking a little bit about how I got involved in this movement personally. I was protesting against the Gulf War in 1991 because a friend of mine was in the military and I wanted to bring him home alive. And eventually he wrote to me, after I wrote to him, he said, I got 10 letters, 9 were supportive, and then there were yours. I was like, how much more supportive can I be than wanting to end the war? So we don't talk to each other anymore. But during that war, Kurt Vonnegut wrote something about how the Gulf War was kind of like this stink that's coming out from underneath the Thanksgiving table, and nobody wants to say anything about it. And to me, the fact that the committee does not talk about the individual scenarios that led to the deaths of people in the mental health community is very disturbing. It's that same kind of odor under the table that people aren't talking about. And we get bounced around and are told there's so many levels of oversight over this, and really we don't need to add another layer. Well, except that when you read the Police Review Board reports about the considerations about whether there was any violation of policy, there's no mention of a person's mental health status in the reviews of people who were killed by the police. The ones just came out about Tobin Henriksen, who was shot in the middle of the street within seconds of the police showing up. And there's just no mention of the mental health aspect, or whether the people who are reviewing this are even thinking about the mental health aspect of it. So that's why I think it's your committee's duty to weigh in and have some reflection on those individual incidents. And I'm really hoping that, and I'm realizing this isn't a question, it's more of a statement, but really hoping you'll think about that and how, you're talking about these scenario-based things and all the training, but if you're not looking at what specifically happened in these cases, they're going to keep happening. And that's my opinion.
I do admire and appreciate the work you do and your passion. And I do have one question of you, though. What I am really interested in is working towards solutions. And I would love to hear your ideas in working towards the solutions, and what are the changes you would like to see and how you would like to see those into action. I'm rather than the questions, what are your solution focused ideas?
Well, for one thing, I'm not a mental health expert. For another thing, I'm not a person who is trained in handling mental health crisis situations. But I would say that the goals of Portland Copwatch and certainly goals of the movement that were in the streets last year is to take away a lot of the interactions that are now given to the police that could be given to other people. And that's why the Portland Street response is very important. And I heard that it was an important thing for people to get to, and I heard that you discussed the ECIT training, but I didn't hear whether or not you actually got around to discussing the PSR protocols. But then we also have these other non-armed officers who are called public safety support specialists. They're not armed. And I think that's, the more we can find situations where we're not putting people who have guns attached to their hips and are trained to shoot to stop the threat, the more likely it is we will reduce the number of police shootings. So that's my proposed solution, is to make sure to involve people who aren't militarized and likely to cause physical harm to people.
I would like to add that we did get a chance to discuss PSR, and we will continue to discuss PSR because it is a pilot program. So there is ongoing and regular conversations about this, something very near and dear to me at 911 since we are dispatching. So rest assured that is an ongoing conversation with this committee and all of the folks that are involved in the program.
Dan, I really appreciate the question. And having, stood in my yard on more than one occasion in front of my son for fear of what was going to happen to him when the police were there. I know that things happen, right? And that's not with the Portland Police. I've never lived in the Portland Police District. So I think that's a really important question. And I also, all this stuff is just so complicated and so entwined with laws and with systems that are not Portland laws. They're this, as a country, how we've decided to manage a mental health condition. So I think for me, it's where I just always have to come back to our system of care that includes more preventative work, more supports for people, so that we don't find ourselves in a situation where a very ill person is in front of an officer who feels like they have no resources. I mean, I'm not here to make excuses for anything or anybody, but we've really, I think, my opinion, need to stop talking in sound bites, because this is not an easy solution.
That wraps it up for part one of the show about the Behavioral Health Unit Advisory Committee. And you may have noticed that they were saying, oh, we can't talk about the details of these cases. And my initial question was, do you talk about those shootings and deaths at all? So they were just filling in those gaps and assuming what I was talking about and making it much more complicated. Anyway, we'll see you next week for part two on the Flying Focus Video Bus. Thanks for watching.